Breastfeeding the small baby. Most small babies take many weeks to develop the skills and strength to effectively breastfeed. This video will show ways to support and guide a mother to meet the special challenges of breastfeeding her small baby. To understand the challenges, let's compare a full-term baby at the breast. His head is supported by strong neck muscles. His mouth is big enough to attach at the breast. And he suckles and swallows vigorously, getting plenty of milk. The small baby, by contrast, appears weaker. He's unable to control his head movements, and his small mouth makes it difficult for him to attach. He's not yet able to suckle and swallow, so he really gets no milk from the breast. And he tires easily. Here are some helpful ways to support breastfeeding in the small baby. First, promote skin-to-skin care right from birth. The baby's closeness to the breast stimulates his feeding instincts and leads to early attachment. Continuous skin-to-skin care in the weeks that follow help the small baby start breastfeeding sooner. Teach the mother how to express her milk. A small baby learning to feed at the breast will not need to work hard if the milk flows easily with his mother's generous supply of milk. This will allow the baby to get all the milk he needs despite his weaker jaw muscles. Expressing frequently and early on is vital to building up a plentiful supply of milk. Feed the baby whenever he signals his hunger. Feeding cues may be subtle at first. Awakening, moving his lips, and eventually opening his mouth. As the baby matures, his signals will become more obvious. Feed small babies often, every 2 to 3 hours, day and night. If the baby stays asleep beyond 3 hours, gently wake him up to feed. Promote practice time at the breast. Though most small babies will need to be supplemented by feeding tube or cup, the baby will breastfeed sooner if he has the chance to become familiar with the breast. Before each feed, have the mother put her baby to the breast. Rub her nipple back and forth and express a few drops of milk onto her baby's lips. This practice time helps to stimulate the baby's feeding instincts. Teach the mother positions that best support her small baby as he learns to feed. The traditional cradle hold, which most mothers have seen and so will naturally try, is not best for small babies. The baby's head, which should be held securely in the bend of the mother's arm, tends to move about and is not supported well for good feeding. Instead, teach her positions that support her baby's head and body. In this first position, the mother lies back comfortably. She supports her baby's whole body. This position calms the baby, stimulates his feeding instincts, and can help a small baby attach more deeply. The next position, often called the cross cradle, supports the baby's head well. Here, the mother holds the baby close to her with his body lying along her arm. Her hand supports the baby's neck and head. She brings him to her breast, facing her, the baby's belly touching her belly, with his ear, shoulder, and hip in a line. While supported, the baby attaches at the breast. The underarm hold is also helpful for the small baby. The mother positions the baby along her side, tucked under her arm, holding her baby's head in the palm of her hand. When the baby's mouth opens, the mother pulls him in to attach at the breast. This position gives the mother a good view of her baby's attachment. To support the baby's head while feeding, the mother may try this hold. She cups her breast underneath with her thumb and first finger free to support the baby's head and neck. His jaw rests in the sling between her thumb and first finger. If the baby is having difficulty attaching effectively, the mother may help him by shaping her breast in line with the baby's mouth. This allows her breast to fit into the baby's small mouth more easily and helps him attach more deeply. Teach the mother how to attach her baby. Have her rub her nipple on his lips, then drip milk into his mouth. Be patient. When he opens wide, have her bring him directly onto her breast. Though the baby's mouth is naturally smaller, he is still well attached. His mouth is wide open, his chin touches the breast, and his cheeks are rounded. More areola is seen above the baby's mouth than below. The baby is drinking well. Notice how his jaw drops, and there is a brief pause as he swallows. He is now able to coordinate suckling, swallowing, and breathing. As the baby matures, his sucks will gradually become stronger and more regular, his attachment will be deeper, and he will have the stamina for a full feed. The mother may hear swallowing, and her breast may feel softer after a feed. When the baby's drinking slows down, the mother can compress her breast to increase the volume of milk and keep her baby interested and actively suckling. Have her compress and hold as the baby suckles. Then ease up when the baby rests. Have the mother give her baby short rests during feeding. It's hard work for the small baby. She can then switch to the other breast to see if her baby is still hungry. A small baby who is fed well feeds for at least 10 minutes on each breast and sleeps well for 2 to 3 hours between feedings. After the first week, the well-fed baby will gradually gain weight and will have frequent yellow stools, 4 or more each day. Most mothers of small babies become frustrated, even discouraged, over the length of time it takes their baby to learn to breastfeed. Being present to give feeding guidance to mothers of small babies is crucial. Support mothers and reassure them that as the baby grows and develops, his strength will improve and he will become more efficient at feeding. Remember, continuous skin-to-skin contact helps small babies establish breastfeeding sooner. Support the baby's body as he learns to breastfeed with the lying back, cross cradle, and underarm positions. Give the mother support. Her baby's ability to attach well will improve as he grows and matures.